Welcome back to the deep dive. If you're keeping track of just how fast things are moving in health tech, AI, care delivery, well, you're in the right place.
Absolutely.
Our whole mission here is really to cut through all that noise. We want to distill the really impactful stuff from the week's news across biomedical, biotech, digital health.
Think of it as your shortcut, to staying genuinely ahead of the curve on the developments that matter in our fields.
Exactly. We've sifted through a pretty diverse stack of sources this week. We're talking major announcements from national health systems, some really interesting tech giant moves, and even big strategic shifts from global providers.
And the goal is to connect those dots for you, show you the underlying currents, not just the headlines.
Because these aren't just news items in isolation, are they? They have direct implications for anyone involved in this space, how clinical practice might change, how the market itself is shifting. So let's just jump right in.
Let's do it.
Okay, so first up, let's dive into what the UK's National Health Service, the NHS, is doing. I mean, they seem to be stepping into really uncharted territory here.
Yeah, it's quite groundbreaking, actually. It's part of their big 10-year health plan.
Right.
And they're seriously committing to using data in a, well, pretty unprecedented way to boost patient safety.
So what's the core idea? What makes it so revolutionary?
Well, the fascinating part is how they're baking AI right into their operations for proactive safety. It's a new early warning system.
Okay.
And it's not just about looking back at things that went wrong.
Yeah.
Which is kind of the old way.
Standard audit trail sort of thing.
Exactly. This system is designed to automatically spot safety issues, pretty much in real time.
Real time. That's the kicker, isn't it?
It really is. It's meant to constantly scan these huge NHS systems, flag potential problems way earlier, and that triggers more focused, earlier inspections. And it fits perfectly with what the Health and Social Care Secretary has been talking about: reforming regulation, trying to root out poor performance, improve outcomes across the board.
That real-time element, it sounds incredibly powerful. It really shifts things from being reactive to, well, predictive. But what are the specifics? What can we expect, say, in the initial rollout? How does it actually work day to day?
Well, they're moving fast.
Yeah.
Work's already underway. And there's a specific module, a new maternity outcomes signal system that's actually set to launch across the NHS this November.
And maternity first.
Yes. So specifically designed to use that real-time data to flag things like higher than expected rates of stillbirth, neonatal death, brain injury.
Wow.
Imagine it sifting through tons of anonymized patient records, staff reports, picking up on subtle patterns that might just get missed otherwise.
Like recurring issues in one specific hospital ward, maybe?
Exactly. Or spotting that a certain hospital has unusually high rates of something compared to the national average. Things that indicate a systemic issue. And the bigger picture, the hope is, it could analyze hospital databases to find wider patterns of abuse, serious injuries, even deaths that might currently slip through the cracks.
And when it finds something,
then the Care Quality Commission, the CQC, gets alerted.
Yeah.
They can then deploy specialist investigation teams to jump in quickly, figure out what's going on, and take action.
So it's really moving beyond just catching individual mistakes to finding those deeper systemic problems that maybe traditional audits wouldn't catch for months or even years.
Precisely. That's the goal.
And I heard NHS England is sort of leading the charge on this globally.
They are. It looks like England will be the first country in the world to actually trial this kind of AI-powered warning system for patient safety, specifically using routine hospital data and also reports from staff in community settings.
That's significant.
It is. The real insight here isn't just about finding errors faster. It's about fundamentally changing the whole feedback loop in healthcare. AI turns all that data into like a predictive warning system,
Right.
which is a massive jump from just reacting to incident reports after the fact. It shifts the burden from finding problems after they happen to proactively preventing them.
Which, for a system the size of the NHS, must be a monumental task.
Oh, absolutely. And look, there are challenges. The sheer scale, the different IT systems across trusts, varying data entry practices, getting standardization, breaking down silos that's going to be critical for it to work well everywhere.
Sure, the practical implementation hurdles.
But if they can pull it off, it really represents a paradigm shift towards proactive risk management. And that could mean really substantial improvements in patient outcomes for millions of people.
A really profound move. Okay, sticking with AI, because it's clearly a huge theme. Let's pivot to another really fascinating development. Microsoft is making some serious waves in diagnostics.
Ah, yes, MAIDXO.
Tell us about that. Microsoft AI Diagnostic Orchestrator. What's the story there?
Yeah, MAIDXO. It represents a pretty compelling leap. There's a recent study showing this AI system achieved remarkably high accuracy diagnosing complex medical cases.
How high are we talking?
When they set it up for maximum accuracy, it hit 85.5%.
85.5%.
Correct. Which is, well, it's a dramatic difference compared to the average accuracy they reported for generalist physicians in the same study, which is around 20%.
20%. So more than 4 times higher accuracy from the AI.
Right.
That's genuinely staggering, especially for complex cases.
It really is. Think about what that means for patients who are struggling to get a diagnosis for difficult symptoms.
Absolutely critical. But what about the resources, the cost? I mean, better accuracy is great, but healthcare systems are always looking at the bottom line.
Right, and that's another key finding. The study authors reported MAIDSO actually reduced diagnostic costs by 20% compared to using human physicians for the same diagnostic tasks in their setup.
Okay, 20% lower cost.
And interestingly, if you compare it to just using an off-the-shelf large language model like OpenAI's O3, the cost saving was even bigger, 70%.
70% less than a standard LLM.
Yeah. So the takeaway was significantly higher accuracy, and it used fewer resources.
Yeah.
That's crucial for thinking about scalability, getting this adopted widely, especially where resources are tight.
Okay, that combination is powerful. How exactly did they test this, though? What was the setup?
It seems quite rigorous. The Microsoft team tested MAIDXO against 304 real-world case studies. These are sourced from the New England Journal of Medicine, so high-quality, complex cases.
Right, the gold standard.
And for comparison, they had 21 practicing physicians from both the UK and US with 5 to 20 years of experience tackle the exact same diagnostic challenges.
And those physicians averaged 20% accuracy on these specific cases.
Yes, so the study reported, yes.
Yeah.
Which really highlights just how well the AI performed on this particular very challenging set of cases.
So what's the fundamental edge the AI has here? What allows it to outperform experienced clinicians so dramatically in this test? Is it just faster processing?
It's more than just speed, I think. It touches on the nature of expertise itself. Human specialists, doctors, are incredibly deep in their specific fields, right?
Of course.
But realistically, no single doctor can be an expert across every complex medical field simultaneously.
Makes sense.
The key insight from the Microsoft team seems to be that the AI doesn't have that limitation. It can draw knowledge from across many different medical fields at the same time. It cross-pollinates information in a way a human brain just can't manage.
Ah, so it's connecting dots across specialties.
Exactly. Think about a rare genetic disorder. Maybe it has neurological symptoms, but it also affects the heart, the kidneys. A human specialist might focus on their area, right?
Naturally.
But the AI could potentially recognize that whole systemic pattern, drawing links that a single human might miss. So the really profound idea here isn't just that AI is a better calculator. It's that it's potentially a new kind of diagnostician.
A different kind of thinking almost.
Yes. One that can see patterns across specialties that no single human brain could possibly hold all at once. And that could fundamentally redefine the role of the expert in medicine.
So the implication isn't necessarily replacement, but augmentation.
Precisely. It suggests a future where AI could significantly augment clinical decision-making, boost diagnostic efficiency, and maybe even democratize access to that kind of expert-level insight, especially in, say, remote or underserved areas. It's about adding an intelligent layer to enhance human expertise.
That potential for democratized access is huge. Okay, so AI is changing diagnosis, safety, clearly pointing to new ways of delivering care. And speaking of delivery, there's a major player making a really radical change to their structure to capitalize on these trends. Apollo Hospitals in India.
Yeah, this is a really significant strategic move unfolding over there. Apollo Hospitals, already India's largest private hospital network, is planning to spin off its digital health and its pharmaceutical businesses into a completely separate company.
A separate entity. Okay.
Yes. The board proposed it at the end of June. It basically bundles together several incredibly valuable assets into one new focused unit, still unnamed as far as we know.
And what exactly is being bundled into this new company? What are the key parts?
So it includes their existing telehealth services, their big digital health platform, Apollo 24/7, which has been growing fast.
Right.
Their quite substantial offline pharmacy distribution business, and this is critical Keimed.
Keimed.
Yeah, Keimed is one of India's largest wholesale pharmaceutical distributors. So Putting all that together, this new spin-off company is projected to bring in almost $2 billion in revenue just this year.
$2 billion. For the spin-off alone, that really underscores the scale we're talking about.
It absolutely does.
So what's Apollo's strategy here? What's the vision behind this move beyond just, a financial restructuring?
Well, their stated goal is pretty ambitious. They want to create, and I quote, the largest integrated omni-channel healthcare ecosystem in India.
Omni-channel, meaning physical and digital blended together.
Exactly. The aspiration, they say, is to serve over 100 million Indians. The real insight here, I think, isn't just the spin-off itself. It's a strategic bet on the convergence of digital and physical healthcare.
Right.
Apollo is essentially saying the patient journey isn't just in the hospital anymore. It spans apps, physical stores, remote consultations, and they're building the infrastructure to own that entire continuum.
Moving beyond the traditional hospital walls.
Completely. This separate entity is designed for seamless delivery. They can leverage their 7,000-plus physical pharmacy stores, their online platform that serves over 19,000 PIN codes, that's India's version of zip codes, covering huge areas. And having Kind integrated ensures the whole pharmaceutical supply chain integrity. It's about delivering trusted quality and availability across an incredibly diverse and massive population, which involves complex logistics and understanding very different regional needs.
That is a truly massive vision, especially for India's market. Just to give us some context, what does Apollo's existing business look like, the part that stays with the main hospital group?
Well, currently, Apollo runs a deeply integrated operation already. We're talking over 10,000 beds across 73 hospitals, more than 2,500 clinics and diagnostic centers, something like 6,000 pharmacies that were part of the main group, and over 500 telemedicine centers.
So this isn't a minor shuffle, it's a major strategic realignment.
Absolutely. It's about focusing and scaling up the digital and pharma arms into their own high-growth powerhouse. And you can see how this impacts integrated care models more broadly, market consolidation, digital health becoming absolutely central to scaling access, especially in large, diverse populations like India's. It's kind of a template maybe for how other large providers might structure themselves going forward.
A powerful model. Okay, so we've seen AI, we've seen market strategy. Let's bring it down to the ground level now. How are care models evolving, especially around payment? We're hearing about Cadence launching something new, almost stealthily, in primary care management.
Yeah, this Cadence development is really interesting and timely, especially when you consider the ongoing squeeze on physician reimbursement.
Right, a perennial issue.
It really is. And primary care providers, who are so crucial, identifying chronic diseases, wellness exams, mental health support, they're unfortunately among the lowest paid in healthcare.
Despite being the front door for so many patients.
Exactly. So there's this critical need for new models that actually recognize their full value. And the Centers for Medicare and Medicaid Services, CMS over in the U.S., is actively trying to address this.
Okay, so CMS is stepping in with something specific.
They are. They created something called the Advanced Primary Care Model, or APCM. It was announced back in November 2024, and the payments actually went live January 1st of this year, 2025.
APCM. And what does it do?
The goal is to support what they call longitudinal primary care for Medicare patients. Basically, care that follows you consistently over time, not just one-off visits.
It's continuous care. Right?
Yes. It's structured as an extra monthly bundled payment. The idea is to promote that ongoing relationship between primary care teams and their patients, recognizing the value of continuous management, proactive outreach.
So it's not just fee-for-service anymore. It's a monthly payment for managing the patient's overall care.
That's the core idea. Shifting the incentive away from just the number of appointments towards the quality and consistency of care over the long haul.
That sounds like a really crucial shift. What specific things does this APCM payment cover? What kind of services does it encourage that maybe weren't well compensated before?
It covers a range of things focused on proactive access and coordination. Things like ensuring patients have 247 access to the provider's team.
Okay.
Coordinating care quickly, say within a week after a hospital discharge. Offering home visits, expanding clinic hours beyond the standard 9 to 5 Monday to Friday, providing secure messaging options for easier communication.
Things that take time and resources but didn't neatly fit into old billing codes.
Precisely. CMS actually said in their proposal for the 2025 physician fee schedule that, a lot of resources go into virtual check-ins, asynchronous chats, coordinating between different specialists, managing complex cases in real time. Yeah. Stuff that existing fee-for-service codes just didn't capture or pay for adequately.
So APCM is designed to fill that gap.
Explicitly. Moving away from just paying per action towards paying for better overall health outcomes and quality care delivery.
Okay, and how does Cadence fit into this picture? They already do remote monitoring, right?
Exactly. It seems like a perfect alignment. Cadence has been a big player in remote patient monitoring since 2021. Their medical practice staffed with MPs, RNs, MAs currently monitors physiological data for, I think, 50,000 patients every day across 18 different health systems.
50,000 patients daily. That's quite an operation.
It is. So their new advanced primary care management business can leverage that existing infrastructure, that expertise, to participate directly in this new APCM model.
Makes perfect sense.
And what's really insightful here is seeing how these new payment models like APCM are deliberately designed to do a few things.
Yeah.
Stabilize primary care financially, which is critical.
Definitely.
Encourage innovation in care delivery, using things like connected devices, maybe AI down the line, and really foster that more proactive, continuous relationship with patients. It's a real concrete step away from the fragmented fee-for-service treadmill toward a more integrated, value-based approach,
Yeah.
which feels like a win for everyone involved, especially patients.
Yeah, that seems incredibly significant for the future of primary care. Okay, so stepping back, looking at the whole picture from this week, it feels like we've touched on some major themes. AI getting much more sophisticated, both for safety and huge systems like the NHS, and for diagnostic power with tools like Microsoft's MAI DXO.
Definitely a big thing.
Then we saw these big strategic shifts, like Apollo Hospitals betting hard on integrated omni-channel healthcare, blending the physical and digital.
Right, restructuring for that future.
And finally, this really crucial piece about payment models evolving, like the APCM, to actually support and incentivize more advanced continuous primary care, driven by CMS, but enabling companies like Cadence.
Absolutely. It's clear we're in this period of really rapid transformation. You've got technology, business strategy, policy, all converging, all pushing to redefine how healthcare actually gets delivered and experienced around the world.
So here's the thought to leave you with as you process all this. Given these rapid strides in AI, these new ways of delivering care, these big strategic consolidations, how do you see the fundamental structure of healthcare delivery changing in the next, say, 3 to 5 years? And maybe even how might your own role within that structure evolve when you think about how all these forces play together?
That's definitely the big question, isn't it? Because these aren't just abstract trends, they're actively reshaping the ground beneath our feet.
It certainly is food for thought. And with that, we wrap up another deep dive. We hope unpacking these developments was valuable for you. If it was, please do consider subscribing to the deep dive for more explorations like this, digging into the critical information shaping our fields.
We'll be back next time with another set of key stories to analyze.
Until then, thanks for joining us.